there anything I can do?
Yes, can you tell me why my dad's not peeing? He's not drinking. His clothes changing.
Part of the transitioning process is the blood pressure will drop. It may not pee as much. In addition to the color may
No, it's
change.
switching back to a full code. Me and my dad gonna walk out the hospital. I'm not doing this
Oh,
right
you want
now.
to change him to a full cold?
Yes, I want to change it to a full code.
Well, what I can do is I can call the doctor and we can get him at the bedside. So, you guys can talk
Yes, I
further about
refuse for you
that.
guys to kill my dad.
Okay.
We're leaving
All
out the
right. Well,
hospital
then,
right now.
is there anything else you need? I can do some water,
No, just call
crackers.
the doctor.
Okay. All right. Hey guys, welcome to my channel. My name is Nurse Jumpin' Jackson, and I pretty much just talk about issues that I go through on a daily basis as being a registered nurse. The skit that you saw just earlier was a real one. It was a situation where I had a patient, a family member. She was going back and forth about her losing her dad, and after talking to her constantly, finally she made her dad do not resuscitate DNR and DNI as well, do not intubate. But with education and educating her about the signs of transitioning, she still wasn't too receptive towards it. So a lot of the changes that the patient was going through with the color changing, the patient wasn't eating, wasn't drinking, wasn't peeing. It just didn't wrap her mind around like he's dying, and I don't like to use the word dying. Transitioning is the more a professional word. I feel like it's a lot more sensitive because most people don't want to hear the word death. So that's why I think transitioning is more appropriate when you're having a family member who's going through this experience, because it's really, really hard. They go through so many type of denials. One of them is like they're gonna get up, they're gonna go walking. Like, why can't he stand? Like, the patient has been bedridden for 15 years. What do you mean why he can't stand? He's not going to be able to. And they go through those denials, and it's like, oh my gosh, like, this is so hard and it's so frustrating sometimes to, because it's like when you're talking to them, they don't see or hear anything that you're saying. They're literally see what their family member used to be like. They used to be able to walk. Why can't they walk right now? Because they're dying. They're normally overly optimistic about just the chance. Like, Jesus, God, I do believe in miracles. But at a certain point, I think that a miracle, if it's too far off, I'm not saying that it can't happen, but just how the picture I showed you in that skit, where they're just like skeletons, they look like death, like they're on their way out the door. And the family member's like, no, they're going to get up. And so then they also demand excessive treatments. Like, oh my gosh. They want you to, bring a bunch of ice, bring a bunch of water. They try to feed them, and they're not drinking, they're not eating. And all you're going to do is cause them to aspirate, and then they're going to end up with pneumonia, or they may croak even faster because you didn't put stuff in their lungs, because they're not able to swallow, they're not able to eat. There's a reason why they're not able to do those things, because whatever disease process that's going on, they're dying from it. So they're not going to be able to eat. So they do things like that. They demand excessive treatments, and it's like, we can give them a bunch of antibiotics, we can give them a bunch of oxygen, we can put them on a ventilator. If it's their time, it's their time. There's no excessive treatment that's going to help reverse that whole process of death. And then of course they actually, like, in my experience also been frequently, they want a second opinion with everything. If I take their blood pressure, and I'm like, can you have somebody else take their blood pressure, because I don't know if that's right. Well, they're dying. The blood pressure is going to be low. Well, I feel better if you was that, have somebody else do it too, just to make sure that, this is real. Or they want a different doctor. Like, they could be an internal medicine doctor for the daytime. They're like, well, let me choose a different doctor, because I don't think they're ordering the right tests. They need this test, that test. I don't know. Something tells me that they're not ordering the right test. So let them try a different doctor. So they'll do that. And so it kind of delays the process, and it puts the patient in more pain, especially if they're in pain. And it's like, you want to delay the process of them transitioning. And what if they're in pain and they're on a morphine drip? And now you'd be like, no, I don't want you to kill my dad or my family, whatever. Take them off the morphine. They're gonna survive. They're gonna get out the bed. They're gonna walk, and it's so heartbreaking, because for the patient, you're like, I know they're going through it, and it's just this family member that just doesn't see what's going on. They don't want to accept it. And then another thing too that their family members do when they have a loved one that's passing, they're so fixated on small improvements. I had experience this one patient. the family member was comatose, right? It's been comatose for years. So finally they decided to go ahead and let him die naturally, take him off the ventilator. And so that's what we did. And so of course the patient was still breathing, saturation was like 70%, but it's going to take it a couple of days before they transition. But the family member was just sitting at the bedside, staring at their loved one. And I think the loved one may have twitched his eye like this. And then he's like, oh my God, he could be waking up. Oh, are you sure? Are you sure that, maybe we could put back some oxygen, maybe wake up? I'm like, yeah, the eye twitch, it could have been just a bodily response. We don't know what it could be, but at the end of the day, that doesn't mean that he's going to come back just because he said eye twitch. Because I'm like, we haven't done no type of movement for the past 2 weeks. Fixated on small improvements. And it's so sad. Everybody grief process is different. Some people grieve better than others don't, whatever. Everybody grief process. So as a nurse, and for me, I do my best to be there for them. And I try to help them get through this process. And whatever they ask me to do, as long as it's not outside my scope of practice, I'll do what I can to help them transition. And as a nurse, sometimes it can be it's like heartbreaking for yourself because, you're trying to put your heart out there to help somebody go through this process, especially if they're by themselves, they don't have other family members with them. When they're going through this process, it could be very hard. But anyways, thank you guys for watching. If you have any comments about what are some things that you do to kind of help, patients go through the grieving process when they are having these issues with, avoidance of discussions about death. They don't want to talk about it. So we have these words like transition. When they're overly optimistic expectations where they think that a miracle is going to exist. Like, what do you do or say about these things? Or when the patient is demanding excessive treatment, like, what do you do when they're doing that? Like, how do you transition that? I want frequent second opinions. They look at what you're doing. I'm like, I want somebody else to do it because I don't know if it's done right. Or if they're fixated on small improvements. So as a nurse, how do you guys manage this? Or even not a nurse, it could be doctors, it could be any discipline. Let's collaborate and talk about this. Don't forget to like, subscribe, and share the content and comment also. And let's continue this collaboration. And I'll see you on the next video. Bye-bye.